Something genuinely good is happening for seniors in the United States this June. And for once, the news is not a warning, not a deadline, and not a rule change designed to make your life more complicated. It is actual good news, confirmed good news, the kind that puts real money back in your pocket and real relief into a retirement that has been absorbing rising costs from every direction for the past several years. And the reason most seniors don't know about it yet is the same reason they never know about the good stuff. Because good news about senior benefits doesn't trend, doesn't get covered the way the bad news does, and doesn't come with a letter in your mailbox explaining exactly what changed, what you now qualify for, and what you need to do to make sure you receive every dollar and every benefit that June 2026 has made available to you. That is what this video is. Consider it your personal briefing on everything that is working in your favor right now, broken down by what it is, how much it is worth in real dollar terms, and exactly what steps you take to access it. Stay through the entire video because these benefits layer on top of each other, and the seniors who understand how they stack together are the ones who walk away from June 2026 in a fundamentally different financial position than they were in 6 months ago. Before we get into the good news, subscribe right now and turn on the bell. I know you have heard that before on this channel and on others. Here is why it specifically matters today. The programs and adjustments I am covering in this video all have access windows. Some of them are open right now and close at the end of June. Others open in July, and you need to know they are coming so you can prepare the documentation in time. Others are ongoing, but have enrollment periods that reset annually, and missing the reset means waiting another full year. What this channel does is track those windows and get you the information before they close, not after. The seniors who are subscribed get the timing right. The ones who find these videos 3 months later get the information, but miss the moment. Subscribe, turn on the bell, and let's talk about what is actually going right for you this June. The first piece of good news involves Social Security payments, and it is bigger than most people realize. The 2026 cost of living adjustment came in at a rate that is meaningfully higher than financial analysts were projecting 18 months ago. And for seniors who have been watching their fixed income get quietly eroded by grocery prices, utility costs, and medical expenses. The difference between what was projected and what was actually approved represents hundreds of additional dollars per year that were not in anyone's budget forecast. For a senior receiving $1,800 per month in Social Security, the 2026 COLA translates to an additional $158 per month compared to last year. That is $1,896 per year in additional income that requires no application, no phone call, and no action on your part if you're already receiving benefits. It was applied automatically to your January payment and has been in every check since. But here is where the action step comes in and why June specifically matters. The Social Security Administration processes benefit record corrections in waves throughout the year, and June is one of the primary correction processing months. If your earnings record was updated at any point in the first quarter of 2026, a corrected employer submission, a self-employment income adjustment, a recalculation triggered by a survivor benefit review, that correction reflects in your June payment. Which means your June check may be larger than your May check. Not because of a new program, but because a correction that was owed to you has finally been applied. Log into your My Social Security account at ssa.gov and compare your current benefit amount against what you received in January. If there is a discrepancy that you cannot explain, call 1-800-772-1213 and ask for a benefit verification letter that breaks down exactly how your current payment amount was calculated. You are entitled to that explanation, and you should have it. The second piece of good news is about Medicare, and it is the kind of news that has been a long time coming for millions of seniors who have been watching their Medicare costs rise every year without any corresponding improvement in what the coverage actually does for them. Effective in 2026, the out-of-pocket prescription drug cap under Medicare Part D is now fully in force at $2,000 per year. That is the ceiling. No Medicare Part D enrollee will pay more than $2,000 out-of-pocket for covered prescription drugs in 2026 regardless of how many medications they take or how expensive those medications are. For context, before this cap was implemented, there were seniors in this country paying $6,000, $8,000, even $12,000 per year in out-of-pocket drug costs while living on fixed Social Security incomes. That era is over. But here is what the good news comes with as a condition, and it is an important one. The cap only protects you if you are enrolled in a Part D plan. Seniors who declined Part D when they became Medicare eligible because they were healthy and not taking medications at the time, and who are now taking one or more prescription drugs, are not protected by the cap unless they enroll. And late enrollment in Part D comes with a penalty, a permanent premium increase of 1% per month for every month you are eligible but not enrolled. The good news is that in June 2026, there are special enrollment period provisions that may allow seniors in specific circumstances to enroll without penalty. Call 1-800-MEDICARE, which is 1-800-633-4227, and ask specifically whether your situation qualifies for a special enrollment period and whether the $2,000 cap can be applied to your current medications if you enroll now. One phone call, potentially thousands of dollars in annual savings permanently. The third piece of good news is about a program that has existed for years, but has been so poorly publicized that the majority of seniors who qualify for it have never heard its name. The program of all-inclusive care for the elderly, known as PACE, has expanded its service areas significantly in 2026, meaning seniors in communities that previously had no access to the program are now eligible to enroll for the first time. PACE is a comprehensive care program for seniors 55 and older who need nursing home-level care, but want to remain living at home or in their community. It covers medical care, prescription drugs, physical therapy, occupational therapy, meals, transportation to medical appointments, and in many cases adult day services, all coordinated through a single program with a single point of contact. For seniors who qualify for both Medicare and Medicaid, PACE is available at no cost. For seniors who qualify for Medicare but not Medicaid, there's a monthly premium, but it is typically far lower than the combined cost of the individual services PACE replaces. If you or someone you love is managing multiple chronic conditions, taking multiple medications, struggling to get a medical appointments, or is currently spending significant money on home health aides or adult day services, PACE may consolidate all of those costs and all of that coordination into one program that costs less and delivers more. Visit pace4u.org to find out whether there is a PACE program now serving your area in 2026 and what the enrollment process looks like for your specific situation. The fourth piece of good news involves something that seniors who own their homes have been waiting for, and it is arriving this June in the form of expanded property tax relief programs in states across the country. Following federal legislative pressure and significant advocacy from senior organizations, more than 30 states have either introduced or expanded senior property tax exemption and freeze programs in 2026. A property tax freeze means that regardless of how much your home's assessed value increases due to rising real estate prices, your property tax bill stays exactly where it was at the time of your enrollment. For seniors in markets where home values have risen 20, 30, or even 40% over the past several years, a property tax freeze is the difference between being able to afford to stay in the home they have lived in for decades and being slowly taxed out of it. The expanded 2026 programs in many states have raised the income eligibility thresholds, meaning seniors who applied previously and were denied because their income was slightly above the limit should apply again under the new thresholds. Contact your county tax assessor's office. Ask specifically about senior property tax freeze and exemption programs updated for 2026, and ask what the new income limits are. In many counties, this conversation takes 15 minutes and results in a permanent freeze on one of the largest fixed expenses in a senior's budget. The fifth piece of good news this June is about something that affects the quality of daily life in a way that the financial benefits on this list do not, and it is the expansion of senior-specific broadband and connectivity assistance programs that have been funded and deployed in June 2026. For seniors who have been paying full retail price for internet service, The updated Lifeline program and state-level senior connectivity initiatives have combined to make discounted broadband available in more communities at higher speeds and with fewer bureaucratic barriers to enrollment than at any previous point. Why does internet access belong on a list of great news for seniors in June 2026? Because every program on this list, the Social Security benefit verification, the Medicare Part D enrollment, the PACE program lookup, the property tax exemption application, all of them have online application options that are faster, more accurate, and better documented than the phone or in-person alternatives. Seniors with reliable broadband access navigate these systems more effectively, make fewer errors on applications, and access their benefit information more quickly than seniors without it. Affordable broadband is not a luxury for seniors in 2026. It is the infrastructure through which every other benefit on this list is accessed most effectively. Contact your internet provider and ask specifically about senior discount programs and Lifeline enrollment assistance. If your provider does not participate, visit lifelinesupport.org to find providers in your area that do. Here is the summary of what June 2026 is actually delivering for seniors who know where to look. Log into ssa.gov and verify that your COLA adjustment and any Q1 record corrections are fully reflected in your current benefit amount. Call 1-800-633-4227 and ask about the $2,000 prescription drug cap and whether a special enrollment period is available if you're not yet in a Part D plan. Visit pace4u.org and find out whether PACE has expanded to your area and whether you or a loved one qualifies. Call your county tax assessor and ask about updated 2026 senior property tax freeze and exemption programs and the new income thresholds. And contact your internet provider about senior broadband discounts and Lifeline enrollment. This is what good news looks like when you know where to find it. It is not accidental. It is not automatic. It goes to the seniors who know to ask for it. Now you know. Subscribe, share this with every senior in your life, and I will see you in the next one.